This lecture will be on some heart topics, namely position of the heart in the thorax with the left atrium in the back and the right ventricle in the front. For anatomy of the heart, we will mention that enlargement of the left atrium can cause dysphagia, which means difficulty swallowing, by compressing the esophagus, or hoarseness by compressing the left recurrent laryngeal nerve. We'll also point out that since the right ventricle is the chamber closest to the anterior surface, it's more likely to be injured in trauma. For example, it's gruesome, but a stab injury. I won't show a picture of that. This picture, by the way, is an axial CT, and the patient's anterior is facing the top of the slide, which is the way axial CT is presented. So the right ventricle is right by the breastbone there, which we call the sternum. Aside from the lub-dub of the S1 and S2 heart sounds, when blood flow through the heart has some turbulence at a valve or at a hole like a VSD, it can make a murmur sound. And one valve problem that can cause a murmur is called mitral stenosis. You know that the mitral valve is the door between the left atrium and the left ventricle. And you also know that stenosis means narrowing. The most common cause of this narrowing is rheumatic fever, where in response to a Streptococcus pyogenes infection, your body sort of overreacts, and due to what is called molecular mimicry, which term I don't particularly like, the body attacks its own cells. For auscultation of the mitral stenosis murmur, you'll want to know the mitral area, which we also call the apex, because it's the pointy part of the heart. As a clinician, you need to know to put the stethoscope at the left midclavicular line, fifth intercostal space. And just slowing that down for a sec, we have a left and right collarbone, and you know where the middle of the left clavicle is. And then if you palpate the ribs, if you can palpate them on this patient, between the fifth and sixth ones would be the fifth intercostal space. Now, let's assume that stenosis murmurs happen when the blood normally flows forward through the stenotic valve. When does blood normally flow forward through the mitral valve? Is it during systole? If you think of systole as the ventricles, particularly the left ventricle contracting, when the left ventricle contracts, blood should be going forward through the aortic valve. So it's not during systole. Rather, the murmur from mitral valve stenosis is diastolic, because during left ventricle diastole, the left ventricle is relaxing and filling, taking blood in from the left atrium. Blood passes the mitral valve on the way in, and if the valve is stenotic, the blood flow makes a murmur. The murmur doesn't start right at the dub sound, so you can hear the dub and the f as distinct. It's like lub dub f, so we call it delayed. There are two murmurs which sound less severe when there's more blood in the heart. These are mitral valve prolapse and hypertrophic cardiomyopathy. The other murmurs, including our mitral stenosis, sound more severe when there's more blood in the heart. Again, for most murmurs, except mitral valve prolapse and hypertrophic cardiomyopathy, the severity goes along with the amount of blood in the heart. So it's okay to say, in most cases, the severity goes along with how much preload there is. By the way, I always wondered why they decided to call it preload instead of maybe just load, but I'm not a cardiologist and I won't be one in this lifetime. Now, both leg raise and squatting help get blood back to the heart. So both of those maneuvers increase the preload. So both squatting and passive leg raise make most murmurs louder, and that includes mitral stenosis. It gets louder with increased preload. I think of Valsalva as shutting the entrance to the heart. So when the patient does the Valsalva maneuver, less blood is returning to the heart. For most murmurs, including mitral stenosis, less preload means less murmur. So Valsalva makes mitral stenosis quieter. Now, where is the blood right before it passes the mitral valve? That's right, it's in the left atrium. If the blood is having trouble passing the stenotic valve, what might happen to the left atrium? Okay, it might get larger. So, mitral stenosis can cause enlargement of the left atrium. And then, what is the left atrium close to? We know it's the most posterior part of the heart, and we already said what it's close to. So, an enlarged left atrium can cause dysphagia by compressing the esophagus. That's right. Or by impinging on a branch of wandering cranial nerve 10, aka the vagus nerve. And the branch that we're talking about is called the left recurrent laryngeal nerve. By impinging on this, the left atrium can cause something called Ortner syndrome, also called cardiovocal syndrome. Maybe that's a better name because it's descriptive. The result is hoarseness. And again, since the right ventricle is the most anterior part of the heart, it is most commonly injured in trauma. Okay, let's tie it all up. If you get strep throat from Streptococcus pyogenes, the antibodies you make against the strep pyogenes M protein can cross-react with self-antigens like myosin, and you can have a type 2 hypersensitivity reaction, which we call rheumatic fever. This is a major cause of mitral stenosis. The murmur from mitral stenosis is best auscultated at the apex, otherwise known as the mitral area. This spot is in the fifth intercostal space at the left midclavicular line. Since the murmur occurs as the left ventricle fills, it's a diastolic one. It's considered mid to late diastolic because it doesn't start while the S2 sound is happening. And for bedside maneuvers, mitral stenosis, like most murmurs, is louder with squat or leg raise, which both bring more blood into the heart. Mitral stenosis is, on the other hand, quieter with Valsalva, which prevents blood from getting back into the heart. Mitral stenosis can cause left atrial enlargement. An enlarged left atrium can cause dysphagia by compressing the esophagus. An enlarged left atrium can also cause hoarseness of Ortner syndrome by compressing the left recurrent laryngeal nerve. And as a quick throw-in, the right ventricle, since it is in front of the mediastinum, it's particularly vulnerable to traumatic injury. Okay, that's it for this one.